This is Brent of the Brookbush Institute, and in this video we're going to go over vibration or percussive release for the hamstrings. I'm going to have my friend Yvette come out. She's going to help me demonstrate. I'm going to have Yvette go ahead and just lie belly down. So she's going to be in prone. This is a really easy technique, guys. So you guys will notice I have the flat piece on here, the flat, stiffer piece. I tend to like this piece more because of how consistent a feel it gives. As I've mentioned in a few other videos, a little counterintuitive, we start on the highest settings and stay superficial to start, and then we're going to work our way back on the lower settings but go deeper. I'm going to go ahead and just control Yvette's ankle here and the amount of knee flexion she has to control the amount of tension in the hamstrings. And I'm going to go ahead and start on the lateral hamstring, because we kind of know from research and some of the common dysfunctions that we see that the biceps femoris, the lateral hamstring, tends to be the more overactive of the hamstring group. So you guys can see here, I'm just going to kind of move my way through the entirety of the muscle, nice and slow, trying to get the whole thing to calm down a little bit, get all that tissue melting underneath the hypervolt here. But I am taking note of any tissue that I think gives me a little kickback, where I feel Yvette maybe trying to guard on me, that might be a little bit more sensitive, or maybe I see some fascicles pop out, get that twitch response because I hit a trigger point. Those little points I'm going to keep in the back of my head, and I'm going to go back and tackle them a little deeper with a more pointed piece using this hypervolt. How's that feel, Yvette? Good? Be careful, sometimes it takes a couple seconds for people to desensitize, so if you go right at them with it, they'll either feel pain or they'll feel ticklish. Sometimes it takes a couple seconds to desensitize, so don't just dig in real hard. You guys will notice I'm basically using the weight of the hypervolt, which weighs almost nothing. The frequency and amplitude are going to do most of the work for you. Alright, so now that I've gone through the whole muscle, I'm going to go ahead and turn this off. I'm going to take the flat piece out. I'm going to use the bullet piece. You could probably also use this forked piece if you wanted to. But we're going to use this bullet piece. And I noticed just a couple of trigger points. Now your common trigger points in the biceps femoris happen to be about 2/3 the way up the thigh, right in the kind of center of the biceps femoris long head, and then the other one tends to be about 1/3 of the way up from the knee, and that's the trigger point for the short head of the biceps femoris. So we'll go back just on setting 1. All right, put a little slack in that tissue so I can get a little deeper. And I'm just going to try to get that denser area to melt underneath this now smaller piece, which means more pressure per square inch. Alright, so we got that little area done. And then I'm going to come back. I felt something right up in here. There we go. Alright, so we get all this to calm down. And you guys are going to see pretty quick that inside of just under couple minutes here, I'm done. I've got a nice release from her biceps femoris. Now, if you wanted to, could you follow up with static manual release techniques, or do your pin and stretch techniques, or maybe even instrument-assisted soft tissue mobilization? Absolutely. The effect that we get from this technique is a little different. I will show you guys one other technique you could do for the hamstrings. Go ahead and flip over if you don't mind, Yvette. We could do this in the position of a hamstring stretch. So go ahead and lay all the way back. I could have Yvette, just like I was going to do like some sort of biceps femoris stretch, right? And I could try to go over her hamstring this way. Just a warning. If somebody is larger than you are, if they're really tight, not that I like to use that word, but they have an overactive biceps femoris, so you're getting a lot of kickback, this is going to be a tough position for you to stay in for a very long time. It's not that this is a bad position for your client, it's more of one of those things that's probably not a great position for you. So you can use this technique. It does work very well. Obviously, I can put now tension in the biceps femoris from both the knee and the hip side, but I would use it sparingly so that you don't wear yourself out. How does that feel? And of course, after I would do this technique, I would reassess, because obviously with all of these vibration release techniques, we're not just doing a cool technique with a cool tool. We want to be trying to affect the outcomes of an assessment that we're using that address the specific issue that your patient or client came in with. I hope you guys enjoyed the video. I hope you guys enjoy these hypervolts from Hyperice. Total game changer.